Now, it was during a conversation about blood donation a couple of weeks back. One of our listeners left a really interesting voice note pointing out that some people actually donate blood more frequently than the usual 8-week gap between donations because of a condition called hemochromatosis. And I had never heard of it. I'd never come across such a term before. I wanted to know more about it. So we're really delighted to have the opportunity to explore it today, both from the patient's perspective and from a doctor's. The patient is Dylan Harbour, who sent us that voice note a couple of weeks ago. So let me start by saying welcome to the show in person, Dylan, and thank you so much for tipping us off about this condition. I'm so pleased to have you with us to share your story with us.
Thanks. Hi, Pippa, and hello to your listeners.
And then also a warm welcome to our guest in studio, Dr. Caroline Hilton, who is the head of the medical division at the Western Cape Blood Service. Caroline, thanks for joining us to explain some of the medical terminology behind this. It's lovely to have you here.
Thanks, Pippa. Thanks for having me here.
Let me start with you and a few basic questions before we hear Dylan's personal story. What is hemochromatosis?
So hereditary hemochromatosis is a genetically inherited disease that can result in people storing too much iron in their bodies. So under normal circumstances, we have this amazing feedback or communication system set up in our bodies where our iron stores instruct the receptors in our gut how much iron to absorb. So if your iron stores are low, those receptors will be instructed to increase absorption through iron in your diet. And similarly, if your iron stores are too high, those receptors will be instructed to decrease absorption. So that regulatory mechanism doesn't quite work properly in patients with hereditary hemochromatosis.
And why is it a problem to end up with potentially more iron than you would normally have? What does that do to the body?
So potentially that excess iron can be deposited on different organs in the body. So typically there's excess iron deposited on the liver, but it can also happen on the pancreas, and you can end up getting diabetes from that excess iron deposition. There can also be iron deposition in the cardiac muscle, in the heart, even in the skin, which gives people sort of a bronze tinge to their skin. So this, just to put it in context, only really happens when the iron levels are very high. So many people with hemochromatosis have higher iron stores, but they don't necessarily have this iron deposition.
Okay, so they don't show any of the symptoms you've mentioned, and they carry on leading a normal life.
Exactly, yes.
Yeah.
So some people find it completely incidentally. So perhaps they go to their doctor, they test their iron store levels or their ferritin, it's noticed to be high, and then genetic testing is performed. But they were completely unaware of it. So common symptoms that people can experience would be perhaps fatigue or some joint pain. Those are probably the most common symptoms that the patients that we come into contact with have.
Okay. In more serious cases, though, I mean, you've mentioned the laying down the impact on the cardiac muscle, the liver, the pancreas. You've mentioned the likely or the possibility of diabetes. I understand that, if it's a really severe case, you can see organ failure and other chronic disease coming from it. Is that correct?
Absolutely, yes. So that's sort of like many diseases, is a huge spectrum of how somebody can present.
Okay.
And those people would be on the far end of the spectrum. So the majority of people can actually lead a very healthy, normal life with the condition.
Is it true that it's usually only picked up a little bit later on in life? This isn't really a disease of the young?
Yes, so as I said, it's a genetically inherited disease. So somebody would always have it, but it does only manifest later on typically, unless perhaps you had a family member who had it or a parent, and then you specifically have testing for it. So in women, for example, it typically presents later because we do lose iron regularly through menstruation. Yeah. So that iron excess is sort of compensated for in some way. But it's typically found incidentally. Otherwise, it crops up when people complain of fatigue, joint pain, and sort of it's tests are done and that cause is drilled down too.
Okay. Once you have identified it and identified that the iron levels are high enough to need to deal with them, what is the recommended treatment?
So blood donation is a great way to reduce your iron stores. So when somebody is diagnosed with hereditary hemochromatosis, they can be referred to us as what's called a therapeutic donor.
Okay.
So we treat therapeutic donors exactly the same as our regular donors, except that they can donate blood more frequently. So depending on what your iron level is, your ferritin, your doctor will prescribe a certain bleeding interval, and then you'll come and donate blood with us. And hopefully in most circumstances, we can use your blood.
That was going to be my next question, is it safe to give to a patient?
Absolutely.
Yes.
So provided you meet the criteria of a normal blood donor, you aren't taking any problematic medication, you haven't had specific cancers, etc., then we would very happily use your blood. So it's a win-win situation.
Thank you very much for setting the scene for us. So that gives you a bit of an overview of the condition we're talking about, hemochromatosis. Dr. Caroline Hilton with us in studio, head of the medical division at the Western Cape Blood Service. Let me bring in the person who started this conversation. Dylan is somebody who called in to tell us about being a more regular blood donor because of hemochromatosis. And I invited him to join us today just to give us the perspective on living with this disease. And Dylan, thank you very much for agreeing to do that. When were you actually diagnosed? And how did you become aware that you had hemochromatosis?
Yes, so I was actually diagnosed in 2018. I was 32 years old at the time, and similar to what Dr. Caroline said, it was more of an incidental diagnosis. I actually had no symptoms at the time, or none that I knew of. I think looking back, I definitely did suffer from fatigue and just generally being tired, but I thought that was just normal life that everyone was dealing with. But having gone through that, I think that definitely was a serious symptom that I was dealing with. But I actually found out through doing a DNA test that was not related at all to this side of my health. It was actually just with a dietitian. And the dietitian recommended I do a DNA test to help inform the best diet that I should be eating. From that DNA test, there was a gene impact that was identified on this specific gene that deals with iron absorption. And basically, long story short, I got this information through to my GP, and she immediately referred me to a specialist physician. At the time, my iron ferritin was sitting above 700, which is quite high for an iron ferritin count, and currently I target bringing that down to below 50. So it took me about a year and a half of doing regular donations. At one stage, I was doing donations up to every week for a period of time, and that obviously reduced down as my ferritin kind of stabilized. And you can't donate too often because it impacts other things in like your hemoglobin levels and things like that. So that was very well monitored and managed by my physician. But basically, for the last couple of years, I've been donating quite regularly, but I'm now down to a normal interval with donating just as everybody else does every 8 weeks.
Every second month. Okay. I mean, you must have been on first name terms with the entire Western Cape Blood Service at one point, Dylan. I mean, how a lot of people are, 3 or 4 people asking the same question. How on earth can you donate that much blood and still feel okay to go about your daily life? Do you want to tell us how it felt?
It actually doesn't feel that bad. I think that it sounds worse than it is. The only real, I think, from what I understand, your blood volume is kind of replenished within a day or two, definitely in the actual volume that you carrying within your body. So you don't feel like you're literally being bled dry, but it's more just the process that you're going through, and I guess it's more of a head game than anything else. I didn't feel like it really impacted me in any way that wasn't very manageable. So yeah, it's really not that bad, even though it does sound quite hectic doing it every week.
Yeah.
It's just more of a process that you follow, and that was quite a short time. That was only for a couple of months that I was doing it so regularly.
I suppose on the flip side, you get to walk away with the knowledge that you're giving a great amount of blood into a system that really needs it, and people who are waiting desperately to receive it must feel pretty good, Dylan.
Yes, absolutely. I mean, this is one of the few diseases in life where there's a plus side to it, and you can actually share the gift of blood with other people. Incidentally, I had started donating blood the year of my diagnosis, not knowing that I had hereditary hemochromatosis, or not knowing the benefits of donating blood at the time. Although I was already down that road of being a blood donor, it's amazing to be able to do it as often as I do, and with extra incentives for my own health at the same time.
Dylan, thank you. Please stay on the line in case we get any listener questions directed your way. If you do want to ask a question, you're welcome to call in on 021 446 0567. Send me an SMS to 31567 or a voice note to 072 567 1567. Caroline, let me come back to you. Let's just pick up on that question that several people have asked about the safety of donating blood that often, because Dylan's vouched for the fact that he felt fine doing it and it didn't have any serious impact on him. But, I mean, there's a reason there's an 8-week window between blood donations. Is that all about the iron levels?
Absolutely, okay. Yes. So regular blood donation does deplete your iron stores. And we know this for a fact, so that's why we specifically have that 8-week interval.
Okay.
So Dylan could donate more frequently because his stores were excessive.
Yeah.
And that was just sort of chipping away at them. So what we've actually implemented quite recently from March this year is checking those ferritin or stored iron levels in all our blood donors, okay, and identifying when people are actually iron deficient, informing them of that result, and then suggesting that this gets followed up with their own doctor. But similarly, we're also finding a few of our blood donors with very high ferritin levels, and we also inform them about this. And then they take that information to their doctor, and then perhaps that doctor would consider testing for hereditary hemochromatosis or another cause of iron overload. And then another thing to mention, every time you donate blood, we check your hemoglobin level.
Yes.
And that needs to be above a specific level. So we are protecting you from becoming anemic every time you donate blood. So that is our safety net to some degree. But now we're also doing the ferritin testing. So we just want our donors to be as safe and healthy as possible.
Okay, thank you. Just for the sake of those who might have joined us late to the conversation, my guest in studio is Dr. Caroline Hilton, who is the head of the medical division at the Western Cape Blood Service. And then Dylan on the line with us is a patient who is living with hemochromatosis and described to us how at one point he was donating blood on a weekly basis to chip away at those ferritin levels, with the very nice side effect of knowing that patients in need of blood could receive his. A question for you, Dylan, from one of our listeners on the WhatsApp line. He wants to know, how has this diagnosis changed your lifestyle? Have you changed the way you eat? Do you eat more or less of certain foods? What did you have to change, if anything, about the way you go about life?
So to be honest, I haven't changed much in the way that I eat, although I am fully aware that certain meats and spinach and cooking in high iron pots and things like that could increase your iron ferritin count. It doesn't really make much of an impact for me because I'm going to be donating blood anyway, and I'm monitoring my iron ferritin anyway. So for me, there hasn't been much of a change other than being a very devoted blood donor. And then also because it's a hereditary condition, that obviously that information needed to be shared with my family for them to be tested as well, to see if they were impacted in the same way.
Thank you for that, Dylan. Now, speaking of the testing, I mean, Caroline, you've said that many people live with this condition without ever showing any symptoms. Given that fact, is it worth doing genetic testing if you know that this runs in the family? Is there anything meaningful you can do with the knowledge that the gene is there?
Well, so typically in hereditary hemochromatosis testing, they test for 3 different types of mutations.
Okay.
One of them, which is a C282Y mutation, is the most sort of clinically relevant one. So it may be useful to know that you have that type, and also whether you're just a carrier or whether both your genes are abnormal.
Okay.
So there could be some relevance there. If you're a carrier, it perhaps isn't as important or, beneficial to know the type of mutation that you have. And then bear in mind also the testing is quite expensive. I think it's probably in the region of about 1,500 Rand these days. So you need to establish whether you want to know the information, whether it's worthwhile, and whether you can afford it.
Okay. Couple of questions coming in on our WhatsApp line, as well as a comment from Jill, who tells me her husband is a hemochromatosis carrier, only has one gene that was passed on by a parent, so he doesn't have to donate blood, but she says he does have to watch his diet and alcohol. Is alcohol intake a significant factor?
Yes, it is. So it is advised that people with the condition, or any liver condition really, do monitor their alcohol intake. That perhaps is more of an issue than restricting iron in the diet.
Really? Okay, that's significant. Thank you. Jill, thank you very much for mentioning that so that we could bring that information to life. Okay. Interesting question on the SMS line from George. Can you develop hemochromatosis from COVID? And would there be any reason that the blood bank would not want your blood?
Okay, so first of all, no, you can't develop hemochromatosis from COVID. It's definitely a genetically inherited condition, so you need to inherit abnormal genes from your parents. Secondly, there are multiple reasons why we don't let people donate blood, and that can range from specific illnesses that people have, whether they engage in any high-risk behavior that would compromise the safety of their blood, perhaps medications they use. So when somebody does want to donate blood, they have to fill in quite an extensive questionnaire just so we can identify any risk to them donating blood and also risk to the person receiving their blood product.
And I'll vouch for that as a regular donor. I mean, I've been turned away from my hemoglobin being just even fractionally too low. They're very strict about that. And the reason is to protect the donor from, as you said, becoming anemic by donating. I've been turned away previously because the medication I was on was counterindicated and not safe for a patient to receive. So that kind of thing does happen all the time, George. But sometimes it's a temporary issue. Sometimes it's a permanent no. And here's a question from Jane on the WhatsApp. Is a cancer survivor ever going to be allowed to donate blood again, Caroline?
Yes. So there are the only specific cancers where we don't allow people to donate, and those are ones that are more prone to or have a very high recurrence rate. So unfortunately, at the moment, people who have had melanoma cannot donate blood ever. And that also is the same for any person who's had a hematological malignancy like leukemia, lymphoma. And then there are more specific cancers like pancreatic cancer, liver cancer, where we discourage people from donating blood. But we've got lots of donors who have recovered from prostate cancer, breast cancer, thyroid cancer, where we just specify a 5-year waiting period just to make sure that they're absolutely healthy. And then we very happily have them back as blood donors.
And just to say, if you're not sure where you fall in those categories, the app is really useful for sharing that kind of information and asking those questions about can I, can't I, how long must I wait? I've just been in a malaria area, so I know I have to wait a certain period before I donate again, Caroline, but all of that information was very easy to find on your website and app. While we're talking about it, won't you share the website with our audience, please?
Yes, it's www.wcbs.org.za.
For Western Cape Blood Service.org.za. I believe we've got a voice note that's come in about ferritin levels. Let's take a quick listen to that.
Good afternoon. I donate blood regularly, and after my last donation, I got a little SMS to say that my ferritin level was below 14, which is not good for women, and I needed to contact my doctor. My hemoglobin level was fine. I've actually been thrilled because they've improved. So I had to learn a lot about ferritin levels being too low. Maybe the doctor could tell us a bit about that.
Great question. Thanks. Would you like to respond, Caroline?
Yes, absolutely. So thank you for the voice note. We do find that some people pass their hemoglobin test, the finger prick test, implying that they're not anemic. They've got sufficient red cells. But actually their ferritin stores or iron stores are low. So those are the donors we specifically want to notify because they're passing the finger prick, but in fact we're doing them a disservice by bleeding them because we're depleting their iron stores even more. So we advise, so generally speaking, anybody with a ferritin below, this is probably a generous target, but below 30 should be regarded as iron deficient. In that situation, we do ask you to let your doctor know, because while regular blood donation can be a reason why somebody's iron stores are low, there can be other reasons, and perhaps more sinister causes like chronic bleeding from the gut that may need to be investigated. So it's best just to inform your doctor of that result.
Okay, thank you. And thank you for that voice note indicating very neatly how the system introduced in March is working, that you told us has been implemented. We have to wrap there. Let me start by saying goodbye to Dylan Harbour. Dylan, thank you so much for being willing to share the patient's perspective with us today and for setting us on the track of this conversation in the first place, and all the best to you.
It's a pleasure. Thanks very much for having me, Pippa.
And then with us in studio, once again, Dr. Caroline Hilton, head of the medical division at the Western Cape Blood Service. I've certainly learned a lot. I hope the audience has too, Caroline. We always are happy to talk to the Western Cape Blood Service and remind our listeners of the ongoing, never-ending need for blood donations and to encourage them, if they are able to do so, to sign up as donors. Thank you so much for sharing that info with us today.
Thanks for having us, Pippa, and also thanks to Dylan for calling in.
Indeed. Thank you very much.